I like doctors of food. Most people wonder what exactly is a dietitian and how can they help you. Dietitians look at a person's diet, look at their activity and their food behavior to figure out how to help the individual. They work with their patients to plan a diet that will work for them and educate them on their current nutrition and health. Most common location for dietitians to work are hospitals, clinics, and their own practice. So if you're trying to find them, that's probably where they'll be. I found an article talking about the trends in U.S. home food preparation, which analyzed several nutrition surveys from 1965 to 2008. Because of its extremely long name, I've just shortened it to Trends in Food Home Preparation. Within the article, it stated that there's been a shift in our current diet towards processed and packaged foods. The foods that are processed and packaged are more energy dense and their nutritional qualities are a lot less. This is extremely concerning for dietitians, and it can be seen as the cause of several health issues. According to the article, our American diet shows that there's a decreased nutritional density, with only 20% of Americans meeting the USDA guidelines for a healthy diet, including fruits, vegetables, low-fat dairy, and whole grains. They also found that for children, half of their energy is from fast food that comes in the home. And so even when they're at home, they're not eating home-cooked foods. This is also very concerning, and it presents a great need for dietitians to show what nutrition is and what food is. Food, and more specifically nutrition, is essential for health. According to Carolyn Denton, a licensed nutritionist in Minnesota, nutrients are the nourishing substances in food that are essential for growth, development, and maintenance of body function. Essentially meaning that if a nutrient is not present, aspects of function and therefore human health decline. Her article, How Does Food Impact Health?, was reviewed by Karen Lawson, an MD, and Linda Armstrong, a registered dietitian. Here in Lincoln County, Erin Smith is a local registered dietitian at Samaritan Hospital. She is a certified diabetes educator, or CDE, and during my interview with her, she explained what a dietitian is and what she does. For her typical day, she meets with in and out patients and company representatives for sample materials and allows her patients to use them if they wish. However, it is made clear that you can't favor any one vendor. Hospital staff meetings are also a part of her typical day, where she goes over the menu and she offers advice on nutrition. Both in and out patient menus and diets are also looked over during her day, and her last typical activity was coordinating with healthcare professionals to make sure that she creates a complete diet accommodating all of their medications and any health issues her patients may have. Erin works in the hospital with her patients, and to become a patient, you have to have a doctor's referral. This referral rule applies to both hospital and private practice. It helps to provide the dietitian with medical history and lab reports. And for a community hospital, a general dietitian is required because you have to work with anything that is ever presented to you. In bigger hospitals, specialists are required because there are several dietitians in a single hospital. You could be an oncology dietitian or a pediatric dietitian within a larger hospital. Her specialty is the CDE, so she's able to teach diabetes classes. And during the interview, specialties available within the career came up, such as geriatrics, pediatrics, renal, weight management, and sports. These specialties are given through the Commission of Dietetics Registration, or CDR, and a certain amount of hours is required to complete that to achieve that specialty. These certifications are not required to become a dietitian, but they have the ability to increase your pay and are the upward mobility of a dietitian. hardest is the CERDR, or Certified Eating Disorder Registered Dietitian. And this is the most complex because it deals with psychology and dietetics. Now, what does that all mean for you? The nutrients you put in your body make it so your cells can function. If your cells are functioning optimally, you're going to have an easier time to fight disease, both chronic and infectious. The American diet right now is not following the recommended diet structure, obviously, with only 20% doing it. And we are relying more on convenience foods than whole foods, confusing our bodies. There are several possible reasons for this, but the prognosis of the doctors of food is clear. The human body relies on food to sustain itself, and if the nutrients is not in the food that it's consuming, the body will not and cannot function optimally or properly. Diet is your first defense against illness. Dietitians can help you to create and mount a very formidable defense against these diseases and illnesses.